In this lesson, we'll finish up looking at the anatomy of the urinary system by taking a look at the structures that make up the urinary tract. In previous lessons, we had done the anatomy of the kidney. Now we want to take a look at the ureters, the urinary bladder, and then the urethra. So let's start with the ureters. These are a pair of muscular tubes, and basically they extend from the kidney down to the bladder. So we've seen this picture before. This would be the left kidney, again a little bit higher than the right kidney, and once the urine is formed inside, the left ureter comes down this way, and then the right ureter comes down this way. They actually come right over the psoas muscles. When the ureter comes down, it's not going to go to the top of the urinary bladder. It actually goes behind. Now it looks like it's draining into the top. It's actually going behind. I'll show you a picture in a minute, and opening up, on the back wall, somewhere down about here where my cursor is here. Right? They don't drain and just open up into the top and the urine drops in. Um, when you see the ureters enter the posterior wall of the urinary bladder, the openings are not going to be round openings. They're going to be more slit-like openings. And that slit-like opening helps to prevent backflow of urine up to the kidney. So let's take a look at what I mean by that. I'm going to jump down here for 1 second. This happens to be the bladder here. We're looking into it. See this slit-like opening here? That's this ureter going behind the bladder and now opening here. And see how it's kind of like at an oblique angle? And by being a slit-like opening, it prevents the urine from going, as the bladder fills up, going in here and then the urine going backwards, right? We wouldn't want retrograde flow. And then here's the other ureter coming down this way, and then it would go behind the wall. We don't see it, then opening up here. Okay. All right, so that's important. These uteral openings are slit-like rather than rounded, and it's going to prevent the backflow of urine. Okay, so those are the two tubes that you should be able to identify in the lab: left and right ureter. This is a cross section of a histology slide. Again, you could see this not very magnified, 60 times. All of this blue here would be the epithelial cells lining the ureter. This is the transitional epithelium, same as inside the bladder, the same cells that line the lumen of the bladder. These are transitional. All right, so here's where the urine would flow. Then we have some connective tissue underneath it. This is the like areolar connective tissue. You're always going to see areolar connective tissue under epithelium. Then this is some smooth muscle. Like we said, it's a muscular tube. And then here's some more just connective tissue. Even some fat cells out here. Okay, so those are the two ureters. The next organ is the urinary bladder. So the ureters are going to drain the urine into the urinary bladder. You could think of this as a hollow muscular organ that's located right behind our pubic bone. And all it does is store urine. It can hold on average about 1 liter of urine. Right? Everybody's a little bit different. And some people can hold more, some people can hold less, but figure on average 1 liter of urine. So let's take a look at the structures that you should know. So when you look inside the bladder, you're going to see that there are folds of the mucosa. These folds are known as rugae. So as the bladder fills, these folds actually unfold or they disappear to allow the bladder to expand, right? If we didn't have these folds and the mucosa was kind of like tight already, we would never be able to fill the bladder up, right? So the rugae are folds of the mucosal lining and they disappear as the bladder fills. So when you look in, all of these folds right here are the rugae. Okay, all of that. Now, before I go back to the notes, the next layer out would be the smooth muscle of the bladder. This muscle is known as the detrusor muscle, and all it is the smooth muscle of the bladder. So you should be able to find that. Notice down here, these were the uteral openings for the ureters. They open into the top of this triangular looking structure, right? One's at this corner here, one's at this corner here. This triangular structure is known as the trigone. Right, it's the trigone, and that's what we're looking at here. It's a triangular area. It's bounded by the opening of the ureters above and the entrance to the urethra below. Okay, so this tube here, this is going to be the tube. This happens to be a male because there's a prostate gland here, but in a female it would be the same thing. This tube right here is going to bring the urine out of the bladder. So that's going to be at the apex over here. Okay, so this whole middle area is the trigone. Here's the ureteral openings right there at the two corners here, and then the urine is going to be drained down this way. Now, the neck of the urinary bladder, that's the region surrounding the urethral opening. Right, so here's the urethral opening right here. So this whole area would be kind of like the neck. This muscle right here on this side and this side of the urethral opening right here, this is what we call the internal urethral sphincter. This is under involuntary control. If we only had these muscles, once the bladder filled, we would just kind of urinate automatically. These would relax and we would urinate. But we know that we do have some conscious control over that, and that's here in the pelvic floor. I'll talk about this in a minute. Again, this happens to be a male, but the same thing would be in a female. This smooth muscle here, I'm sorry, this is now skeletal muscle. This skeletal muscle here and here is the external urethral sphincter. This we have conscious control over. So let's say a bathroom isn't handy, right? This muscle can contract and hold the urine, right? So this is the internal urethral sphincter. It's in the neck, and then in the pelvic floor is the external urethral sphincter. This is voluntary control. We can control that until it's appropriate time to go, find a bathroom. Okay, so rugae, detrusor muscle, trigone, the ureteral openings, right, for the ureters, the neck of the urinary bladder, this area down here, internal urethral sphincter, involuntary, in the pelvic floor, both males and females. That's what the urogenital diaphragm is, by the way. That's the pelvic floor. This is going to be skeletal muscle, and we have conscious control over that. Okay, so I just want to make sure we have everything. So rugae, detrusor muscle, trigone, neck of the bladder, internal urethral sphincter. Again, it's smooth muscle fibers. If you just want to jot down here that it's involuntary, right? If that's all we had and the bladder filled up, that would stimulate the muscle to relax and we would just go to the bathroom, right? But that doesn't happen, thank goodness. Okay. This is a picture, histology slide of the bladder. So right here, this white area would be the lumen, where the urine would be stored. This purplish would be the transitional epithelium, right? So all of this is the transitional epithelium. Wherever we have transitional epithelium, there's going to be areolar connective tissue underneath it, right there. Right? Then there's another layer of connective tissue on that under that called the submucosa. And then here's your detrusor muscle. That's going to be the muscular layer right there. So everything that we saw on this picture, this is it on the histology slide. Okay, so now from the bladder, the urine is going to leave the body through the urethra. So in both male and female, the function is the same. It's going to cause the urine to leave the body. However, in the male, it's a little bit more extensive. The urethra has more parts. It's going to be longer and it's going to have more parts. So here, the urethra extends from the neck of the urinary bladder to the tip of the penis, right? Roughly 7 to 8 inches in length. So there's 3 parts of the urethra in the male I'd like you to know. If you want to give a highlight: prostatic urethra, membranous urethra, spongy urethra, or you can call it penile. Yeah, either one is fine. So let me show you what I mean by that. We'll come back to these notes in a moment. This is a sagittal section through the male pelvis. So you can see here, this would be the penis. All this here, right into the deep inside to the pelvis would all be the penis. Um, this over here is the prostate gland, and then up over here is the urinary bladder. So what we see, guys, like this would be the right ureter coming down. This is the left ureter coming down, and if you notice, it's coming in the back wall of the urinary bladder. We're going to ignore these structures here. This is part of the reproductive system. We'll do that at on another lesson. But notice here, here's the ureter coming down. It enters the back wall of the bladder. Right, and then the urine will be stored in there, and then this is where the neck of the bladder would be in the male. So this first part of the urethra that runs through the prostate gland. Right, so this whole gland here is the prostate. This is going to be called the prostatic urethra. Okay. This is the pelvic floor right here, this muscle right there. That little section right there of the urethra is the membranous urethra, right where my arrow is there, only in the pelvic floor. Then the remaining part, the longest part right here, this whole tube is the either the spongy urethra, and I'll tell you why you call it that, or penile. It's probably easier to remember penile. Um, the reason they can call it spongy is this. This tissue right here that surrounds the urethra here is erectile tissue. We're going to learn this is called the the corpora spongiosum, and it's like I said, it's erectile tissue, so we can call it the spongy urethra. Okay, so your choice, penile or spongy. Okay, I think at this point, penile would probably be the easier one to remember. All right, so prostatic urethra here. Membranous urethra is only this little part in the pelvic floor, and then the rest would be the penile urethra. Let's go back. All right, so the prostatic urethra passes through the center of the prostate. The membranous urethra, right, is a short segment that's in the pelvic floor, right, what we call the urogenital diaphragm. And then the spongy urethra or the penile urethra is going to go from the pelvic floor all the way to the external urethral orifice. What does that mean? So this opening right here above my cursor, that's the opening into the urethra. So this is where urine would come out. We're going to do this again when we do the reproductive system. This tube here, the whole urethra, is shared with the reproductive system. Okay, so we'll see that semen is formed from these structures here in the prostate gland, and semen would also go through this. Right? So it's a tube that we share with the reproductive system. But you do need to distinguish. You just can't say urethra on a lab practical. You have to say prostatic urethra, membranous urethra, penile urethra. Now, if you just said urethra, that would be too general. Now in the female, you'll see that the urethra is much shorter, right? Only 1 to 2 inches, and basically it's going to extend from the bladder to the vestibule. We'll learn this in a subsequent lesson that the vestibule is just the area between the labia minora. These are two folds of skin in the on the outside of the female, the external genitalia. Right? Without getting into that lesson now, we're just going to say this is the area between the labia minora. So take a look here, just to give you a little bit of an idea. So here we can see the ureter coming down. This also is the sagittal section, right, going past the uterus right here, and then it would enter the back wall of the bladder. So here's the bladder. Right, this would be like the detrusor muscle. This is the hollow part of the bladder. And then take a look right here, this tube here, 1 to 2 inches long. This is the urethra, and that's going to open up. Here's the labia minora, here's the labia majora. Right? There's two sets of labia, and this is going to open up right between the left and the right labia minora. Right? That area, like I said, is called the vestibule. So here's the urethra, and then here is the vaginal canal right here. Right, that would lead up towards the uterus. So we'll do that again when we do the reproductive system. Just a clinical note, females typically get UTIs, urinary tract infections, more frequently than males. Not that males can't get it, but they can only because the tube here, the urethra, look at this, is so much shorter compared to the male. Right here, bacteria that would have to go all the way back here, up this way, and then make its way into the bladder. Females, right, bacteria could just go a short run and then cause a bladder infection. So this anatomically the reason females get urinary tract infections more than males. Okay. Um, This is just, we talked about this already, the external urethral sphincter in both sexes. This is a band of skeletal muscle, and it's on either side of the urethra in the pelvic floor. Again, if you remember, the urogenital diaphragm is the pelvic floor. And if you do look at the urethra under a microscope, what you'll see is, again, it's kind of a collapsed lumen here. All of the red would be stratified squamous epithelium. Right, so all of that is stratified squamous. Again, anytime you have epithelium, there's going to be a little bit of connective tissue underneath it. That would be some areolar connective tissue. Right, here's the submucosa over here, and then you're going to have smooth muscle in here also. All right, we'll talk also more about that when we look at the reproductive system also. Okay, so that concludes this lesson on the urinary tract structures. We had looked at the two ureters, the urinary bladder, and then the urethra in both the male and the female.